I was like a broken person.
I didn't follow the requirements I was supposed to. I started them, but didn't complete them, and hid my kids from them for 2 weeks. And then the cops came to my house, and it was just horrible.
When they took my kids, that's when I knew. I didn't really think I had a problem, but I knew something was wrong. Terrible. You know, so, and you see it happen to other people, but you don't think it happened to you.
My name is Nancy Young. I'm the director of the National Center on Substance Abuse and Child Welfare, supported through the Substance Abuse and Mental Health Services Administration and the Administration on Children, Youth, and Families. This video provides examples of the strengths and challenges in developing a collaborative approach to improving outcomes for families. We're going to see programs that have been put together to exemplify policy and practice models that address collaborative barriers and have demonstrated improved outcome for parents and children.
We were failing our families. Before Dependency Drug Court, we only had 18% of families who actually reunified and had their children come home and their cases closed out with parents who no longer had substance abuse problems.
The families that present themselves have multiple problems. It's never just one problem. It's never just drugs, or it's never just mental health. It's never just homelessness, lack of education. And the children have a lot of problems as well. It's not about a clean urine. It's about changing the way you live your life, keeping your children safe, nurturing your children, giving your children a chance to live a productive, happy life without trauma. That's what the goal is.
Making our clients a priority, which is so important to have the whole community recognize that child welfare clients, parents and children are a priority is a big hurdle to overcome.
The importance of seeing the family unit as the client and not the child as one client and the parent as another client. And the importance of integrating treatment into one holistic approach as opposed to having parallel treatments.
Yeah. So like here there's one for orthodontics, pediatrics.
It's so important to build integrity and trust, and it still is. But those first few years were critical. So we really watched everything, and it was important that we shared our information and that we were all upfront with what we were doing. Everyone was involved with building our policies and procedures.
The most important thing to make a system like this work is collaboration. Having everybody at the table from the very start, not bringing in a system and trying to impose it on some of the parties in the system that may not have buy-in. You've got to get buy-in if it's going to work.
At the National Center on Substance Abuse and Child Welfare, we've developed a framework for looking at the connections that need to happen between systems for families. We refer to this as the 10-element framework. We're going to talk about each of these elements and how the two sites that are being spotlighted in this video implemented changes in their systems in these areas.
Everyone agrees that we want parents to be safe, nurturing parents. Everyone agrees that good quality treatment on demand is important, and everybody agrees accountability is needed for people to succeed. And so everyone came together and said, those 5 or 6 things we agree with, after all the yelling and talking and fighting.
All the partners in the systems have the same goal, which is to provide children a safe and nurturing environment where they can grow. We do that by working with the courts, by working with community partners, by working with other service providers, and trying to access all the services that the parents will need so that we can provide them with the tools that they will need to assess that goal.
You have to listen You have to understand that there's expertise in different areas, that there's turf interests, and you have to work with that in a collaborative way. And really make people understand, or allow people to understand, that they're part of this process, that you need them and they need you.
Early intervention specialists review all of the detention reports or non-detaining petition reports so that we can see if there's any possible alcohol or drug issues. Dealing with resistance is the biggest part of our job. We just try to help them get past the resistance to CPS, resistance to services, denial of having a promise, to just get them to open the door to maybe this can help me out.
So I said, okay, I'm going to do it, and I went and signed up for it and had my interview with James at STARS. He's a really nice person.
Accept the notion of services on demand. What that means is if a client comes to court and they're using substances, that they don't have to wait to get into treatment. They can get into treatment that day. If that happens, the rate of success increases. They will go to court, go to the initial hearing, then they'll go right into treatment. They don't have time to go home and use. They don't have time to go home and go to their people, places, and things where they're going to use anyhow.
I didn't want to deal with why everything was going on. I used drugs to feel loss. Me and my friends used to just say we're just blowing in the wind.
A relapse doesn't mean you're out and we're done with you. It means you've had a relapse. Now let's keep going. We've had families where a parent has been close to graduating dependency drug court and has had a slip up. And the true test of that particular parent is, okay, I made a mistake, I'm done, I'm going to walk away. Or, okay, I made a mistake, I'm going to re-engage immediately and actively do what I've been taught to do. Utilize it not only for myself, because that's the most important thing. The recovery must be for the individual, first and foremost.
When clients intake into the STARS program, they are assigned a recovery specialist. A recovery specialist is always of the same gender. In motivational interviewing, we're not telling our clients what to do, we're asking our clients what their goals are. When they're being shamed, they are inclined to run away and hide. But when they are made to feel safe and supported, they'll be more inclined to communicate, to come to us, and to be honest with us. And that's a key component of recovery.
So we do all of our drug testing completely on the spot. We hardly ever send anybody out to the lab to test, and the reason why is the waiting period for the lab is about 2 weeks long before you actually would get a positive result back, and a lot of things could happen in a 2-week period of time.
However, if there's a positive drug screen, we also try to use that as a therapeutic intervention, and we try to encourage honesty, try to get them to see what happened, what was the relapse all about. We don't use it as a punishment. We don't necessarily just close the case, throw everything out.
When I first got into this program, I was very resentful. I was mad. I was getting ready to go to the Capitol and do a fast to get my son back, you know. I really didn't like this process at all. And as I went through the STARS program and realized that these people that are trying to teach me about my disease have gone through it themselves. So that was kind of it was a blessing, because it wasn't somebody who's never experienced what I've experienced telling me what I need to learn, you know. I mean, it was somebody who had actually been there and was doing the deal, staying sober one day at a time.
So much as just want you to be as honest as you can be.
She didn't make me feel like I was a bad parent or anything like that, because that was the most devastating thing that has happened to me yet, is feeling that you failed your children. You know, I was just broken at the time, and she got me engaged and just guided me through, you know, what needed to be done. She was always clear about what needed to be done, what was expected of me, and the consequences if I didn't comply. And so that's what I did.
Everything about a young child's life in the first 3 years is about how they exist within their primary relationships. So the developmental assessments we do on the children when they come into the Linda Bray program are one part, but we actually do relationship assessments. We use videotapes and we do behavioral observations to see how does the parent and the child interact.
We do an intensive clinical assessment, which is called the parent-child assessment, and that is something that we do turn into the court. We screen and assess all different needs that the parent or the child or the family in total may have, and that is included in that report, and we make those recommendations for the court. And in addition, we also speak directly to the caseworkers that are involved with the families so that if there isn't a court hearing that's coming up right away, we make sure that we get in contact with the caseworker so that they can already start those referrals so that the families can get their needs met as soon as possible.
Oh, yeah. We started the parent-child psychotherapy to work on the attachment and the anger issues that her son had with her. The second thing I did was immediately make a recommendation that Audra be allowed to move to a facility where she would be allowed to have her children with her in a supervised setting, and have her children come here to the early intervention program to work on any developmental delays that existed with her son.
Many of our parents do not have custody of their children and are at risk of losing custody permanently. These children oftentimes are in the custody of the Department of Children and Families. Through the years, we have been able to work out with the department that when a child is brought here, that the Department of Children and Families will allow us to share custody with them. The overlying philosophy is guided by a model which is called the Comprehensive Continuous Integrated System of Care. So families who have mental health and substance abuse issues, and how to integrate those problems into a holistic treatment approach.
If I had started with these As we move along the process, we look at GED, education, and vocational. Another aspect of our collaborative are the people that deal with vocational and housing. Housing, of course, is always an issue, but they're all part of our collaborative.
I think when I realized they were really there for me is when I talked to him about, I got a sponsor and I was doing some other stuff on my own as well. And he was like, right on, that's what I like to see. And he told me, a support group doesn't just have to be A or NA. It could be going to church, it could be a Bible study or a book study or, something that's benefiting you as a person,
The STARS program collects data and shares with child welfare, CPS, dependency drug court, and treatment providers. We generate a twice-monthly report which consists of treatment attendance, testing results, number of contacts that clients are required to meet with their recovery specialists, and how many meetings, support group meetings they've attended that they were required to attend.
Each of the agencies and providers support each other. We openly share information about the families. We have constant communication with each other. This allows us then to all have the same perspective of the family, to ensure that we are all headed in the same direction and have the same goals and objectives for the family, and prevents us from having mixed or confusing communications to the family.
Part of the drug court protocol calls for very intense communication and staffing. So once a week, we all get together and we staff the cases. What that means is that we all sit down like in a round table and we talk about their cases.
Everybody knows what's going on in your case. And so that's what creates the safety net, because everyone is on the same page, which creates a sense of security.
Warning signs of possible slip or relapse. So what is a relapse?
It's really important with the Alcohol and Drug Training Initiative that we all work together, that we are cross-trained, that we understand what the courts have to work with, that we understand what the CPS has to deal with, that we understand what alcohol and drug goes through, because it's important that we can actually get a thread and work a client through that thread, as opposed to having them all get siloed treatment. When they get siloed treatment, what happens is that clients fall through the cracks.
We train our lawyers to make sure that your client is open when they discuss what the relevant issues are. especially when it comes to substance abuse.
He didn't do it because there's any hammer over his head. It's because he put some thought into it and he said, this is what would serve me best in my life. Lessons learned from AODTI, I think one of the biggest ones was getting the buy-in of mid-level management. We sort of had to back up and come back in and do supervisors trainings saying this is what we're doing, this is what your staff is getting. And it was a key piece that we didn't get when we had first started this. And so anybody coming in deciding to do this, I highly recommend. If you don't have the buy-in of middle management, it's not going to fly. It's not going to be able to sustain itself in the workplace. I mean, you can have them go to training, and that's great. But if you want change, you have to have the buy-in.
Funding for the Dependency Drug Court and our STARS program took creativity, and it took vision, and it took champions, and it took risk. We had a program manager and a presiding judge who wanted to make this work.
The problem with a lot of this work is that it all started out with grants, but finally the Department of Children and Families realizes that this is really effective, and they're paying for a lot of this dialectic therapy as well. So it's now become not so much soft money, but it's part of what we do. It's a valued component.
We would see some changes, and I'm open to explore that, but
some of the outcomes that we've had in drug court is really higher success rates and reunification. We've minimized the revolving door system where the clients are coming back into the court on new abuse and neglect.
The evaluation strategy for Sacramento County started with we didn't want to do anything more than what we were already doing. In other words, in order to ask people to take on an entire new program and change the way they were doing things, we didn't feel that we could also ask them to learn a new database and new forms and new everything else. What we needed was buy-in. So part of our strategy was that we were going to use our existing data systems, and that was a big piece. That didn't mean we weren't going to add additional elements or unique identifiers so that we could match our information in our databases, but it did mean we were not starting from scratch. Child welfare offers reunification services up to 18 months. So when we first started this program, year one, comparison group was 18%. Year one at 18 months was 24%. By year 5, we're almost at 57%. These are children who are returning to the care of their parents. They're returning earlier. The county saves money. Our children are healthier for it. Our parents are healthier. So all the way around, that's our main key outcome is increased reunification rates. And for those that unfortunately cannot reunify, we also have the majority of those cases going on to the permanent plan of adoption, which is the next best permanent plan.
Interestingly enough, I looked at my first class. We had a drug court graduation here, a statewide graduation, and one of our first graduates spoke. So I went back and looked at the list from the first graduating class. There were 12 women. None of them have been back in the system. And they keep in touch with us. They are working at drug rehabs. They are property managers. They are x-ray technicians. They are involved in our women's group. Mom is graduating today, right? Laversia is graduating. I'd like some of the other drug court parents that are just starting, I'd like them sitting in here so they can listen to her.
That courtroom gets quiet and you can see the effect it's having on all the people around them. When a client stands up there and they say, I got my child back, and you can see the people in the room that say, I want to be just like them. I want my child back too. You know? You can see it.
You actually have to go to court and you have to do all the programs, all the parenting, because it really does teach you a lot when you go through therapy and parenting.
and everything, you know, so it's worth it. I mean, as long as you get your child back at the end, it's all very worth it.
Most I can say is that it's tough and it's hard sometimes, you know, mentally, but it benefits everyone in your family, it benefits yourself and your children, and staying clean and sober, and it's all worth it. Being here and in dependency court working, all of us together, it has tremendously turned around our lives, and I am so thankful. And without any of this, drug court, the village, it would have been possible, and he would have been somewhere else.
I remember when I graduated and she came down off of the bench to come down and take a picture with me. It was like a great moment. A judge is actually coming off the bench to congratulate me on being successful. 6 months prior, the judge had told me that I couldn't take care of my own child, and now they're telling me, congratulations, you've made it, you're a better person.
After receiving treatment, I can see the joy in their face, not only the mothers, but also the children.